My name's Dr. Todd Davis, and I am a dentist at Dental Care at Bixby. So first, I just wanted to start by it's been 7 months since we took your teeth out. I've been wearing that temporary one for that long, and I know when we first delivered it, we were really excited about how it looked, but now that you've been in it for a while, is there anything that you'd like to change for the next one? Anything you like, you don't like?
I like the profile of it.
And the shape of the teeth is good. What about the color? You want to go brighter, darker?
Nah, not brighter.
You like the color?
Yeah, seeing it more natural.
Hey, give me a big smile. Yeah. You want to show more tooth, or do you want to show less tooth?
That's hard to say.
Hard to say.
I've gone so many years without trying to smile. I'm not really used to it, to be honest with you.
Are you smiling a little more now?
I think so.
Okay. I mean, I think you show a good amount of tooth. You know, when you're just kind of talking to me, you barely see any, and then when you smile, we see a good amount. What do you think, Rainey? It's always good to get a second set of eye.
Let me see. Smile for me. I think it's a good amount.
Maybe a little more.
I think it's maybe an 8 and 9, sorry.
Yeah, I think we could go. You want to try a little more length to the front teeth?
I mean, what do y'all think? I don't really...
I think maybe just the hair more. It'll make you look a little younger. Usually as we age, we show less of our front teeth.
Yeah.
And when we're younger, we show a little more.
Oh,
yeah. I think just a little more. So one of the things we want to do is we want to mark our video ahead of time. So Kurt, I'm just going to make some marks on your face that we'll remove later, okay? Kind of like we did a long time ago. So just a mark on the nose and the chin. And we just take a cotton tip applicator, line it up, and you're biting all the way down, Kirk. Okay, perfect. Just stay just like that. So we're not changing Kurt's video. We're pretty happy with where he is. And we want to make sure when we do the silicone reline, we don't open them up too much and go ahead and open. So we'll use that to check. Voice you there.
Section.
Yeah, it's peeling a bit. Oh yeah, it's pretty loose in here. All right, let's clean that up. So usually this is a 5-step process with analog techniques, but with those scanners we have, we can do it in 2. So it's a lot easier on you guys as patients. So Kurt was gluing this guy in. So before we do the fresh liner, we want to make sure everything's nice and clean so it'll stick. So we extracted Kurt's maxillary dentition 7 months ago, and he's been wearing this healing denture that we 3D printed. And so now he's ready to get his new complete denture. And we want to make sure we also let him leave with a good soft liner in here so he has something to wear while we're fabricating the new one. It doesn't take very long. Should have it back in about a week, but the goal is to give Kurt a nice backup here. So the soft lining material we use is resilient silicone. So it's sticks better to 3D printed denture than co-soft, some of those other material. Well, it is a little technique sensitive for sure. So we're going to roughen up the intaglio here. So just removing any other loose pieces. I'm trying to get a nice rough surface area for that sauce line and a barn syrup. I'm going to kind of roughen up the phalanges too, just so we have a nice area for that to stick. It's looking pretty good. We don't have any paintbrushes, right, Manny? Oh yeah, would you grab one for the primer? Thank you. All right, so this is our primer. I think we'll let this sit for a minute, and then we'll do another coat to air dry it. Yeah, we'll let the primer sit for a bit, and then we'll go ahead and air dry and do another coat. So the goal here is usually what we used to do is we would do an immediate. We do the soft reline as needed while the patient healed. And then we bring him in, we take out the soft liner. We do our wash with a medium or light body. And we take that out and then do another soft liner. So there's a lot of material and steps. And the co-soft in those types of brands didn't really scan well. So the silicone-based material is a lot like PBS, and so it scans a lot better. So it'll eliminate a step, and then Kurt goes home with his reline that'll fit better. So he'll leave with a better fitting soft reline than he came in with while he's waiting for his new denture. That's kind of the thought process behind this. Kurt, you ready? Here comes the go. So just gonna do a nice even layer and Kurt's denture here. We're gonna do a little on our borders, the undercut areas. Open curve. But as the excess comes out, we try to help Kurt without gagging him. It's looking pretty good. And bite together, Kurt. Good. I'm just gonna put a little extra on there. Keep biting for me. There you go. Keep biting in this, move this around. Okay, and I want you to open slightly. Then move your lower jaw side to side. There you go, and bite down again. Good. Just keep biting lightly. Your normal bite there. We're just gonna let that goose head up, okay? You're doing great. So you can see we maintain that VDO. It's still setting, but the silicone soft liner's in there. And so we know we didn't put too much opening them up. More important when we do the PVS wash but we still always want to double check, as we had some errors where there's too much material in there, and then it leads to increased VDO that we didn't intend to do. It's always good practice to double check. All right, so we're just checking, and everything seems to have set really well. I'm gonna try to get this out here, Kurt. One of the things we want to assess is retention of the impression or the liner. And again, are you all right, Kurt? It's in there pretty good. We'll try to pop that seal. There we go. You okay? Yeah, I think that's gonna fit pretty well there. Okay, and so looking at this, we got a lot of loose, movable silicone. That is not gonna scan. The scan's gonna capture it in different position. So anything loose or over the occlusal aspect, we checked this bite and this was off to the side. We're gonna wanna trim all that up. So we'll take a 15 blade. We'll just carefully trim anything loose and movable. And then anything that's covering the teeth. So we're just gonna make a nice line across. We'll kind of peel that back. All right, we got that side. Back. I just go right above the gingival extension of the teeth there. So now when we get the scan, it's going to be able to see all the teeth, which is going to help with the bite relationship and also with the design for the lab. If all that's covered, it's going to make it harder to scan and harder for the lab to design. So take another look. Nothing's loose or movable there. We got pretty good borders too. So we're ready to scan. Okay, so the RX on the Itero is super important. This is the Itero 5D. So these are a lot better at scanning dentures than the original Elements. In fact, using the Elements is going to be very painful. So a few of the things we need to make sure we have is obviously the patient data here. But then we need to select the right type of scan. So denture removable, under this setting, the AI cleanup will be disabled, which is absolutely imperative if you're going to be doing this type of scan. Since we are using Kurt's existing denture, we want full denture tissue base. There's a couple other options. If you're doing immediate, obviously you'll choose full immediate. Anything implant, you'll do implant base. So we're going to stick with that. We're going to go to final finish. You have a couple other options here, but we have this process down really well where we're eliminating the try-ins in most cases. You can select a mold. We're going to leave it up to Synergy to do that for us. And we're going to go based off the existing denture. Kurt's pretty happy with that. Shade, Kurt's existing one. What do we got?
B1.
B1? Okay, he likes his shade. We discussed that with him. So we're going to go with the B1. That's what we use for his immediate. And then we're going to do a light pink for the gingiva. Got a new sleeve attached. Now we're going to upload the photos a little later because we haven't taken those yet. And then we're going to add notes as well. So we're going to go to the scan icon here. Make sure you're on the right arch. It'll default to the lower, but we're going to start with the scan of the denture. So we're going to click on the upper there. Got a new scanner sleeve. It is fully seated. If it's not, we'll have issues. And so we're going to start on the occlusal. It doesn't matter on which side. You do want to start on a second molar though. I'm going to go ahead and click the button. Once it captures that tooth, I'm going to roll back to the posterior aspect. And then while I'm going over the occlusal, I'm going to try to capture some of that palate. This is going to make capturing the palate easier later on. And just slow and steady wins the race when it comes to scanning with the Itero. We're going to work our way around in a horseshoe here. Okay, we're all the way at the end, and now we're going to cross the palate. Make sure you're staying in contact with the palate. It's easier to come off of that. And we're going to come to this. Okay, now you saw there, it started to show another set of teeth. So when you see that, pull the wand away. Otherwise, you're going to get an extra set of teeth we call shark teeth. So still having a little issue on that area. You can see that there's our second set of teeth. So I'm going to come back to where I started. And then I'm going to come back down here. The scanner likes teeth. It doesn't like tissue. So you can see it's stitching that together. It's struggling a little bit. Okay, so again, we're going to start on a second molar. We're going to come back and we're going to go all the way around the arch, trying to capture some of that palate while we're doing it. Kind of a wave-like motion here. And then we're going to go slowly down the palate. Okay, good. Okay, so that's our first step. Everything's looking good here. And you can see we got a large portion of the palate when we scan the occlusal aspect. So this is going to make getting the rest of the palate pretty straightforward. So we're going to go up to 8 and 9 here. Let the scanner recognize where we're at. So we're going to slowly come back. Kurt has his name on this one, which will help with the scanning. The scanner likes topography. Color doesn't really matter. Okay, so you can see we got a good palatal scan there. Now we need to get the buccal aspect. So really important, you don't touch this button, okay? Also, always keep the denture stable in your hand. Only move the wand. If you move them together, it's going to confuse the scanner. So now that we have the occlusal aspect, the cameo, we're going to switch. So I like to scan this way. So go ahead, forefinger and thumb, and you're going to start on one of the molars. As remember, the Itero likes teeth, and then we're going to roll through those buccal. And I'm going to go all the way down to the extent of the flange. We're just going to do this wave-like motion, coming back to the teeth, making sure we're getting all that information. You can see we're getting all the way to the extent of the borders there. Okay, and now I'm at the midline, so I'm going to pull the scanner away, and I'm going to change my grip. It's just easier here. I'm going to come back to the other molar. It's going to recognize where we're at. Then we're going to come down to the flange, back up, just that nice W motion. You can see that silicone liner is scanning pretty well. So that is why we like that product. Well, one of the reasons. Okay, and so I lost it. So I'm going to come back to teeth where it recognizes. And I'm going to pull this away. At this point, I still haven't touched the button. You can see the light's still flashing in the air. And we're going to check our scan. This looks pretty good to me. We got a couple little blue areas, but we can see everything we want to. So at this point, we're going to press the button. And what this does is it's going to start a new scan. So when I start again, you're going to see the scan go off to the side. So same process as the occlusal for the intaglio. We're going to start on the most posterior aspect of the ridge. I'm going to click that button. Once it starts recognizing, we're going to do that same horseshoe. Now I'm going to try to capture some of these undercuts as I go. Really trying to get all that information. Slowly going away. And so you can see it's getting lost a little bit. So I'll come back. Make sure that wand is in contact with the denture. The silicone is scanning really well. Now we made it to the other posterior side, so we're going to cross again, just like we did on the occlusal. And there we go. Okay, so let's take a look. Notice I did not hit the button. We got a lot of blue area in that maxillary anterior, and that's pretty normal. So we're going to get the palate first. So we're going to go back up to the interior. We're going to work our way across that palate, get that out of the way. All right, that palate's looking good. So now I'm going to come and I'm going to start filling in that blue by just moving my wand at more of an angle. Really trying to get everything I can. And I'll show you a little trick on getting that maxillary anterior. We got some undercuts there. So for this area, I'm going to pull away. I'm going to reposition here. Then I'm going to come, let it recognize it, and then I'm going to rotate the wand almost perpendicular to try to fill in those deep areas. There we go. But it's getting lost, so we're going to go back to where it recognizes it. Let's bring it away. There we go. So I'll go back to that posterior aspect if it's getting a little confused. And it's not like in this area. Let's come back here. You gotta be a little patient with the wand. Okay, now we're getting those. You can see it's filling in nicely, but that is a really challenging area here. So let's take a look. So you can see we have a little missing data, but we're pretty good. Let's see if I can get it a little more. There we go. I'm just gonna rock in that wand. Now if we have some small areas, 5 by 5 or less, that's okay. The lab can repair those. But if we have large areas of missing data, then we'll want to get an edentulous scan so the lab can mesh those together. So at this point, I'm pretty happy with that anterior. I got a little area. I'll see if I can get that later, but I'm going to go ahead and mesh the two scans together. So we're going to go back to one of the posterior areas here. And then we're going to go ahead and roll. So I typically try to go where we have the shortest area to the T. So right now it's not liking that. So let's go to the anterior. And okay, now it's starting to capture those T. Okay, there you go. And now you'll see those two scans magically mesh together, and just there, that's what we wanted to see. Okay, so you saw the intaglio and the occlusal come together. We have some gloves, but you can see it slowly disappearing. We're taking a look all the way around. We're missing a large part of data back here on the upper right. So we're gonna go clean that up. Look at back here. It starts getting a little slow and it's not tracking, then go back. Okay, so we got that information. Good. You can see a little bit more over here. Let that scanner recognize where you are. There we go. So super important getting that posterior area. But we do have this open. That's not a huge deal. The lab can repair that, but we're going to go ahead and try to get it anyway. Let me go back to the occlusal on this. We'll start on that tooth there. It's the scanner likes teeth. We're going to fill that in. That's looking pretty good. Now notice I'm not hitting my button on my wand. And to get this perfect for Synergy, I'm going to see if I can get that little area there. He's giving me a bit of a struggle. Well, the Itero does have a limited focal distance, so sometimes it just can't get all the way down there. Okay, it looks like we got a little bit. That's probably the most we're going to get. Not too big of a void, so we might have to adjust a little bit in that area. But I'm pretty happy with that scan. You guys like that one? Absolutely. Okay. Okay, so we're going to go ahead and move on to the lower arch. Okay, we're going to go ahead and start on the posterior. Now, since Kurt does have a dentate lower, you don't need to really focus on capturing a lot of soft or hard tissue. And we need mostly for the occlusion. And if no way can ever hurry it. little middle more. Really, we just need it for sure it's occlusion there. And go ahead, tuck Kurt's upper back in. Go ahead, there we go. Make sure it's seated all the way. There we go. If you're okay, Kurt?
Yeah.
We're gonna set him up at a 45-degree angle. I'm gonna click on the bites hand. I gotta go ahead and hope in. Yeah, bite together. Away. Okay, you can see it stitched together. Go ahead on the other side, open, and then bite together. And we do a nice W motion. All right, bite again. Oh, I'm gonna stitch that one in. There we go. All right. So the bite looks pretty good. We're gonna go ahead, turn off go on, and then we're gonna process. The processing generally takes quite a while. We did a bunch of scanning, so it was a good time to go do a couple hygiene exams while we're waiting for this to clean out. Yeah. Sorry, Kurt, I know these aren't fun. Okay, go ahead and bite together. So we want to take some pictures with the soft reline in for the lab so they can see what we see. All right, so we're going to take a look at our scan. It's done processing here. You can see post-processing or cameo and occlusal looks good. We have all the teeth. So really you want to focus on anything that's touching hard or soft tissue. So if we're missing some data on the middle of the palate, that's all right. The lab can fix that. But if we're missing any of the teeth, that's going to mess with the occlusion. So make sure we got a clean scan there. Intaglio, super important. This is going to lead to our retention and stability. And we want to make sure we capture our borders or intaglio. We do have that slight blue area. The scanner just couldn't get down there, but this is acceptable. Like I said, we might just have to adjust a little more in that area, but overall we had great retention when we did the soft liner and we captured 99.5%. So this is going to lead to a good result. And now on the lower, I didn't spend a whole lot of time capturing all the data down here just because we don't need it. What we do need is the occlusal aspects of the teeth and then a good bite. So you can see here, we got a nice stable bite that matched what we were seeing in Kurt's mouth. So that's really important. Double check what you're seeing in the mouth. Make sure it matches the skin. We can also use this feature, we call it the weather map, the occlusal clearance. So we can see we have red areas all the way across. So we know that he's hitting pretty evenly. There's not one area. If we just saw he is hitting on this molar, we'd probably get a red flag that maybe our bite's off. Prescription is super important for letting the lab know what changes you want to make to the denture. Now, Kurt's pretty happy with his denture. We did that interview and he liked the shade, the shape of the teeth. One thing he did mention, or we talked about, we might increase the incisal display a little bit. So I'm going to put that on this prescription. So I'm going to write increase. We're going to go 2 millimeters. I think that'll look natural for Kurt, make him look a little younger. And so we just have that note in there. VDO was good. If you want to make any changes in VDO, we can do up to 2 millimeters digitally. Anything more than that, you're going to want to take a mush bite. We didn't need to do that for Kurt, but if you are going to increase VDO, you need to scan that if it's going to be more than 2 millimeters. Now we're going to go ahead and attach the photos. I did indicate that in my prescription. And I also let the lab know that we want it printed in Lucitone digital print. We want a 3D printed denture, not a milled one. Okay, so now we're going to log into myitero.com and you'll see these 4 screens. We can get to Kurt's scan several different ways, but the quickest way is to go to orders. You'll see that his name popped up right at the top where it says scanning. We're going to go to view RX. And then I do have the SD card in here. So we're just going to navigate to that. Sorry, Windows did an update on me. So he's right here. It was super easy. We're just going to take the photos we want. And we're just going to drag and drop them right here. You'll see they're on the RX. Now to get them to stick, we do just need to come out, and now they are on that scan. So now that we upload the pictures, you're not going to see them here, and that's something that really hangs doctors up. So don't worry about it. They're on there. We're going to go ahead, double check that we have everything here. We got the lab, we have the stages, we have our notes. So at this point, we can go ahead and hit send. And then that'll be on its way to the lab. Then they get going on that digital denture process. We'll have it back in a week.